So here you have the nursing process, right? And so I have all the 5 steps here for you because the first thing you want to do is remember what the steps are. That's kind of half the battle. And so the acronym that we love to use is ADPI or ADOPE. When you think of ADOPE, the outcome, the O in outcome is really involved in the planning. The planning is going to be using the outcomes to make the plan, okay? So for the purposes of this video, I'm just going to do ADPI. Now, whenever you're learning acronyms, it is so important at this stage that you're also writing out what the acronym means, okay? If you're starting to get used to all these acronyms, but you really haven't learned what the term means, for example, a good one is DVT, right? We use DVT all the time. But what does it actually mean? What does DVT mean? Deep vein thrombosis. If you don't start using those words, you're going to forget. And then you're not going to know how to evaluate for this patient. What does this mean? Is it in the artery or is it in the vein? And so it's very important that when you're using acronyms, that you're also writing it out. So purpose of the nursing process, the acronym that we like to use is ADPI. So that's assessment. And assessment is always first. You can't do anything else until you assess the patient, because how would you know what the problem is? How would you know what outcomes you need to establish if you have not assessed this patient? And so the most important thing, if I teach you nothing else in nursing school, is assessment. And I had a graduate once tell me, a brand new nurse tell me, oh, I don't have time to assess. Well, then I'm sorry, you're not doing your job as a nurse, because if you don't assess, you don't know what's wrong with your patient or what could possibly go wrong with your patient. So assessment is always first. And I always like to give you that analogy of a detective, right? When a detective shows up on a crime scene, they don't just start doing, right? They don't just start performing interventions. They first assess and look at the environment. They survey the environment. They get information, subjective and objective information, which is what we also do as nurses. The nursing diagnosis is identifying, once you have gathered all your assessment data, is identifying potential problems that your patient is at risk for or actual problems that they currently have, okay? And now you want to start to plan. Based on the assessment data, you analyzed it and you came up with maybe 1 or 2 or even several nursing diagnoses. You want to start to prioritize that and figure out, well, what is the most important thing? What do I need to focus on first? And as you start to plan, you want to develop outcomes. And we'll talk a little bit about that once we get into the planning slide. And then you're going to implement. So based on the problem or potential problems, you want to start performing interventions. And then lastly, you want to evaluate. Well, what do you evaluate? Well, you're always evaluating the reason why you performed that intervention in the first place. What were the assessment data that you gathered that encouraged you or told you that you need to perform these interventions? Now you want to go evaluate if those are the same findings. Also, we use evaluation a lot when we're teaching. Okay, and so if I'm teaching a patient how to administer their insulin injection, I want to evaluate how they do it by having them demonstrate on themselves, but also talk me through when they would administer this medication and what steps they would take. And so that's another way where we evaluate. So let's jump right in here. So the first thing is assessment, okay? And like I said, you can't do anything else until you assess. So if you're not sure what to do with your patient, first you're going to assess, okay? And what is assessment? Assessment is your subjective data, what your patient tells you, or maybe what the family member told you, or what you received from the chart from the nursing home. Okay, it's information that you cannot yourself measure, that you yourself cannot use your senses to find. And so that may be, in the case of Jennifer Hoffman, she comes in and she's 33 years old. She's has an allergy. She has seasonal allergies. She has a history of asthma, and she's telling you she's been having frequent emergency visits, okay? And she's coming in complaining of shortness of breath. Now, that would be all the subjective data. The objective data would be me actually looking at Jennifer Hoffman, and if she's having shortness of breath, what would I want to evaluate? What would I want to assess? Well, I would absolutely first want to look at take some vital signs, okay? Because my vital signs are going to tell me what's going on, if she's stable or unstable. And specifically because we're talking about the respiratory system, I would want to focus on their respiratory rate, right? I want to listen to their lung sounds. I want to check a pulse ox, right? I'm going to focus, this is a respiratory assessment. Now, later on, once I've stabilized my patient, would I do a system assessment? Would I do a head to toe? Absolutely. But in the beginning, I want to listen to the heart, I want to listen to the lungs, and I want to, help this patient as soon as possible because I know my ABCs are important, airway, breathing, okay? Now, if we're talking about Jennifer Hoffman, what other information would I want to get? Well, I want to find out when this started. How long has she been experiencing this shortness of breath? What was she doing when the shortness of breath started? Was she gardening? Was she, smoking a cigarette? Was she in an environment where there are a lot of chemicals? And then I might even want to do some labs, right? Maybe I want to do a blood gas, an arterial blood gas, and see what's going on. Maybe I want to do a chest x-ray. Okay, and so this is all my assessment data. Now, chest x-ray, blood gas, labs, those are all things I need orders for. But as a nurse, I'm already anticipating that I'm going to need this. And also I'm going to maybe even call my doctor and ask them if I don't see it ordered in the computer. Okay, and so that's my assessment data. Now, in terms of your assessment data, that's going to depend on what's happening with your patient. If I'm going to meet my patient and I'm going to be taking care of this patient for 12 hours and my patient is stable, I'm going to do my complete system assessment from head to toe. But in terms of Jennifer Hoffman, right now she's having shortness of breath and I know that's an emergency. So I'm going to go rush and focus on the respiratory system. Okay? So that's assessment. The next thing is diagnosis. Now, this is different from a medical diagnosis, okay? Obviously, you guys are already thinking if Jennifer Hoffman has a history of asthma, she's had frequent emergency visits, she came in complaining of shortness of breath, then most likely she's probably having an asthma attack right now. However, as a nurse, I'm not going to diagnose that. The provider will be diagnosing. So when we talk about diagnosis, we want to speak about specific diagnosis, nursing diagnosis. So what would that be? Maybe ineffective breathing pattern, okay, related to bronchial constriction or related to exposure to an allergen, as evidenced by respiratory rate of 34, wheezing noted bilaterally, or use of accessory muscles. So we're trying to say the signs and symptoms that led me to believe that she's having an effective breathing pattern. So why don't we go back through that again? When you talk about nursing diagnosis, you want to follow this right here. Okay, so now I'm going to take it back all the way back to assessment because I want to give you a more basic scenario. So why don't we go ahead and use Jennifer Hoffman, but this time around she's a 79-year-old patient who just had a stroke, okay? And she did have surgery, and so she's post-operative. Now, what would my assessment include? Well, this person is going to include, I'm going to do a system assessment because I'm taking care of this patient now from the beginning of my shift. I want to do a full head-to-toe assessment. Obviously, I'm going to focus more on which system. I'm going to do a more in-depth assessment on which system. Okay, well, hopefully you said neurological. Now, I'm still doing a full, complete head-to-toe assessment, but I'm going to be focusing on the neurological system. And if I notice that my patient was lethargic, they were very weak, they just had this surgery, and so they're a little bit disoriented, okay, and they're very weak, and they're not able to move much. The left side is still flaccid. So now my assessment data includes that my patient is flaccid on the left side and still generalized weak. And so based on that, I'm going to say impaired skin integrity or risk for impaired skin integrity related to surgery or related to immobility, okay? Or I might say impaired skin integrity related to surgery as evidenced by redness to sacrum. Now, if I said impaired skin integrity, I'm telling you that this person already has a problem. The skin is already impacted by the fact that this person just had surgery and they're completely immobile, okay? And how could I support that? Well, I'm telling you they have redness to the sacrum, which is essentially a stage 1 pressure ulcer, okay? Where we have non-blanchable redness in a bony prominent area. It's just a stage 1 pressure ulcer, okay? And so if you look at your nursing diagnosis, we're just going to stick with impaired skin integrity related to surgery as evidenced by redness to the sacrum. And the most important thing is that you follow this along, okay? Because sometimes, I just told you this patient maybe is lethargic. This patient is probably going to maybe have some pain. This patient is flaccid on the left side and weak, generalized. Maybe if they are awake and alert and oriented, depressed, okay? They're at risk for pneumonia. There's a lot of things that can happen, but we're sticking with impaired skin integrity related to surgery as evidenced by redness to sacrum. And I might even say, like I said, related to immobility. Now, based on that, I want to establish some outcomes. Okay, I want to start planning for my patient. Remember, I told you some of your patients are going to have more than one nursing diagnosis. So you want to prioritize those nursing diagnoses. For the sake of this video, I wanted to make something simpler. So we're sticking with impaired skin integrity. And then you want to start to establish some short and long-term goals. When you establish your goals, remember that they need to be measurable. Okay, they need to be what we call SMART goals. So specific, measurable, attainable, realistic, and timely. So that I can go back, and this should be a realistic goal for this patient. Example, if this patient is completely flaccid on the left side, it would be inappropriate for me to say patient will ambulate within one day, or the patient will ambulate during my shift, or something like that, where this patient is completely flaccid. That would not be a realistic goal. And so you want to make something that's client-centered, realistic for this patient. Now, you might have had a patient who had a stroke, but they're physically fine, right? They're moving around, they're walking, they're talking, but maybe cognitively, they're a little bit confused, okay? Or maybe they're a little bit forgetful. And so your goals for this patient are not going to be the same. So what's the point I'm trying to make is that when we're establishing nursing diagnosis and we're coming up with a plan and expected outcomes for our patient, it needs to be client-centered. Every stroke patient is not going to have the same plan of care. And so going with this one, we'll say will remain free from further skin breakdown during this shift or during admission as a long-term goal. Okay. There's a lot of other outcomes that you can come up with, but this is just like one basic level. Okay, and so here's my implementation. So implementation is, what are the interventions that I'm going to perform based on the fact that I just said this patient is at risk for impaired skin integrity, or this patient has impaired skin integrity. So a good one would be turn and reposition the client every 2 hours. There's a lot of interventions, right? We would never just perform one intervention. Maybe I want to order the special mattress, air mattress, that's going to decompress and compress to prevent this patient from being on their bony prominences for too long. Definitely, I want to start talking with my ancillary staff, right? My unlicensed personnel, and I want to let them know that this patient is at risk for pressure ulcers and that we need to not only turn this and position this patient every 2 hours, but we also need to provide good skin care. Make sure that this patient is remaining dry. Also nutrition, right? We want to work with our dietitian, and also I know all of that would have been part of our plan. But these are the interventions, is having the dietitian come in and establish what kind of caloric intake they need to be on and what kind of protein intake they need to be on, and actually making sure that this is taking place. And then lastly, you have your evaluation. And so, like I said in the beginning of the video, your evaluation is trying to figure out if your interventions were effective. Did you reach the goal that you set for this patient? Every time you evaluate, you just have to remember that all the reasons why you performed this intervention is what you want to evaluate, okay? What was the goal that you were trying to achieve? Well, that's what you're going to go back and evaluate. So did the sacrum remain red? Did the pressure ulcer heal, or did this patient now develop a stage 2 pressure ulcer? So it actually advanced, and so there's further skin breakdown. And so what happens? Well, if I went back and the skin looks good, there has been no further skin breakdown, my evaluation and my interventions were effective, okay? Then I can move on. But obviously for something like this, you're constantly going to be evaluating. You're constantly going to be making sure that you're still performing your Q2 hour turning and repositioning. You're having the proper diet for this person, the proper bed. Let's say it wasn't effective and the patient developed a stage 2. Well, now I have to start all over again. I have to go back and reassess and figure out what is it that I did wrong, that I missed, or maybe I didn't do anything wrong. Maybe I did everything right, but yet the patient still developed a stage 2, and so I need to come up with a new plan. And so that's your nursing process, right?